Hello viewers, I am Dr. Prashanti. I am an ENT surgeon from Alekya ENT Care. I would like to discuss a few words about snoring or sleep apnea. So what is snoring? It's an abnormal sound that is produced when you are sleeping. Okay, you should be knowing the mechanism of snoring before we really get into the subject. Snoring is nothing like, when an airway passes through a narrow passages, the turbulence that is produced is called as a snoring. So snoring is a primitive term. The advanced version of the snoring is sleep apnea. So what is the difference between snoring and sleep apnea? Snoring is a condition where the patient has snoring, but it is the opposite person who experiences it, and the patient as per se doesn't know that he is snoring. Okay, the second version of it is sleep apnea. Sleep apnea is a condition where the patient himself experiences that he is snoring, and in between, for example, if you take a sleep of 6 hours of sleep pattern, gets disturbed, and every 1 hour or 2 hours the patient becomes conscious, he gets up, he has a choking attack, and again he tries to sleep back. Okay, this is an advanced phase of snoring, and that is called as a sleep apnea. The sleep apnea is again divided into the mild, moderate and severe sleep apnea. So mild sleep apnea is always, and the most common causes for this sleep apnea is obesity, smoking, alcoholism, and sometimes some abnormal conditions, some congenital conditions of the oral cavity, or you can also say that a very high BMI or a lifestyle changes is lifestyle difficulties, or you call the lifestyle disturbances, are all causes for the snoring. So how do you treat snoring? As I said, the sleep apnea is again divided into mild, moderate and severity based on the condition of the patient. If the sleep apnea is not treated, usually it may lead into hypertension, diabetes, and some abnormal lung conditions like pulmonary hypertension, or you may also get into other complications. How do you treat this condition? First, we do a sleep study. Sleep study is nothing but a device that is connected onto your chest for about 6 hours in the night. So probably around 10 o'clock we connect it, and morning 6 o'clock the device will be removed, and we have various recordings from which we come to a conclusion whether it's a mild, moderate or a severe. So based on the severity, we have various options available. So most of the time, as I said, obesity is the common cause, so we try to decrease their BMI. If the patient is alcoholic or smoker, then we just ask them to quit smoking and decrease the alcohol intake. And if the patient is beyond all this, if we think the patient is no more benefited with all these conditions, then we have various surgical modalities available. So, but whatever is this snoring or sleep apnea should be, it is not like, you just don't leave it like it's just a snoring. So it has to be properly dealt and properly treated, or you will end up in lot of complications. Thank you.